Greetings. My name is Dr. Abhishek Nagarajappa. After going through this module, you shall be able to enumerate indications and contraindications of bag mask ventilation, enumerate the equipment required for bag mask ventilation, describe the correct technique of one person and two-person assisted bag mask ventilation, identify effective and ineffective delivery of breaths. Bag mask ventilation is also known as bag valve mask ventilation. It is a basic management technique to provide ventilation and oxygenation to the patient until a definitive airway is established or the patient's respiration returns to normal. This skill is one of the most essential foundation skills for emergency resuscitation service providers. BMV is required in the following situations: patients with respiratory failure, cardiac arrest, and altered mental status with inability to protect the airway. It is also used as an ad interim technique in management of airway in patients undergoing surgery under general anesthesia. It is the go-to technique when there is failure to secure the definitive airway. Contraindications for bag mask ventilation include complete airway obstruction and extensive facial trauma. Equipments required for bag mask ventilation includes a self-reinflating artificial manual breathing unit connected to appropriate size, leak-proof or well-cushioned anatomical face mask, a reservoir bag with oxygen tube, usually which is available in the hospital settings. This should be attached to the self-inflating bag. However, in case of resuscitation in out-of-hospital settings, we may not have reservoir bag or the oxygen connection. Other equipment include an oropharyngeal airway, a nasopharyngeal airway, and a pair of gloves. Get the equipment ready, wear gloves, assess the patient's upper airway for any red flags such as upper airway obstruction, cervical spine injury, or extensive facial trauma. Position the patient. In an unconscious patient lying supine position, tongue may fall onto the posterior pharyngeal wall and cause upper airway obstruction. To relieve this, we have to do head tilt and chin lift maneuver. Here, two fingers of one hand is placed under the chin and the other hand is placed behind the head. By doing this maneuver, the tongue is lifted away from the posterior pharyngeal wall and it relieves the obstruction. As you can see from this figure, the tongue is lifted away from the posterior pharyngeal wall and patient is having a patent airway. If the patient is suspected to have cervical spine injury, head tilt and chin lift is not done. Instead, a jaw thrust maneuver is utilized without extending the head and neck. In these images, you can see the rescuer holding the mandible and doing a jaw thrust technique. In this image, we can appreciate the mask holding technique with bilateral jaw thrust maneuver. Adjuncts such as an oropharyngeal and nasopharyngeal airways can be used in an unresponsive patient. In awake patients with intact airway reflexes, oropharyngeal airway may stimulate gag reflex and should not be used. A nasopharyngeal airway is well tolerated in these patients. However, in patients with maxillofacial trauma, a nasopharyngeal airway is contraindicated. Placement technique of mask. Position yourself behind the head end of the patient. Mask should be of appropriate size for effective ventilation. Apex of the mask should rest over the bridge of the nose and base of the mask should be over the chin. Make good seal to avoid any leak. Commonly used technique of holding the mask is known as C and E technique. Hold the mask onto the face with the thumb and index finger onto the body of the mask, simulating the letter C. Place the remaining three fingers under the mandible to elevate to form the letter E. So this technique is called as C and E technique of holding the mask. The other hand is used to compress the bag and deliver the breath. Same technique can be used when two rescuers are available with both hands for more effective seal. As a result, there will be minimal leak. The second rescuer compresses the bag. Another technique in two rescuer bag and mask ventilation is by using bilateral jaw thrust. The second rescuer compresses the bag. Gently compress the self-inflating bag between the fingers and thumb to provide inspiration. Release the compression and wait for passive expiration. Each compression should lead to corresponding rise of patient's chest. Each breath should be delivered over 1 second. The delivered tidal volume should be approximately 6 to 7 milliliters per kilogram of patient's body weight. In patient with perfusing rhythm who only requires respiratory support, ventilate at the rate of 10 to 12 breaths per minute. If patient is having own respiratory drive, assist the patient's breaths. If patient is having tachypnea, every few breaths should be assisted. In patients with cardiac arrest and ongoing CPR, 2 breaths are given after a series of 30 chest compressions in a synchronized manner. In this demonstration, we can appreciate each breath is delivered over 1 second and expiration is over 1 second. Complications of bag and mask ventilation include aspiration, hypoventilation, and hyperventilation. Factors that may lead to difficult bag and mask ventilation include presence of facial hair, lack of teeth, those with BMI of more than 26 kg per meter square, age more than 55 years, history of snoring, and facial disfiguration such as trauma or tumor. To summarize, bag and mask ventilation is a basic airway management technique until a definitive airway is established that provides ventilation and oxygenation to the patient. It is essential to remember the indications and contraindications for BMV. Airway management techniques such as head tilt, chin lift, and jaw thrust helps in maintaining patent airway and effective ventilation. Proper mask holding with minimal leak is essential for effective ventilation. Ventilate at the rate of 30:2 during ongoing CPR without a definitive airway. When a definitive airway is secured, ventilate at the rate of 8 to 10 breaths per minute. During your bag and mask ventilation, if you come into any problem, call for help as soon as possible. Thank you.